And look, part of this campaign, the reason why we're interviewing some of our stakeholders, etc., is to just share insight. You and I, for example, being in this sector space, we might be very knowledgeable about how the referral system works, but some individuals may just be community members that are curious about finding out more information about mental health. So sharing stories like that is fantastic insight for anyone that may actually require additional support now, or feel whirlwinded by something that may be going on to someone within their direct network. So look, my last question to you is actually, what is a message of hope that you may be able to share with our community here? Because the rationale or reasoning for that is, look, 2020 was a whirlwind for many, and there are so many that are still caught in the eye of the storm. You know, we are predicting that the next wave of the pandemic is a psychological one. So there's lots of people feeling that level of burnout, even though it's the start of the year. And when you're in that peak crisis state, it can feel really challenging. It can feel like there's no hope. So I just wanted to share some insight as to what's your key message, is a message of hope for someone who may actually need to hear it right now.
Yeah, well, I was recently reading about the suicide statistics for COVID, and obviously they were predicted to go up really high over this really hard time. But some of the studies are saying that actually we're not seeing them at the moment going up. We haven't seen that statistic yet. And some of that has to do with is because we're going through this hard time together. So it's actually a lot of community right now. There's a lot of support for each other, and we're all actually having a hard time. Some people more than others, some people for different reasons, but it is a time that you can reach out and say, like, I need some support. I need to talk to someone. And, you know, if you're struggling with anything, blame it on COVID. It's okay. It's a time where you have total permission to reach out for help. It is a time where everyone needs some support. And if you're not reaching out and you're a bit worried about how to talk to someone around you or a professional, there's so many supports right now, and people are really kind right now, and they have the time and the space to talk to you. So I think really it's the perfect time for community support and kindness, and reach out for that professional help.
What a fantastic message of hope. Thank you, Sacha. It's great to, I think, reflect on that insight, right? Because I've seen through social media, there has been a lot of scare in terms of mixed messages going out there with suicide stats. I have seen some misguided campaigns that are pushing out double the amount of suicides that we're seeing in community, but actually no, it's quite hard to see some of that data because the system's a little bit slow in pushing out reports. But what we are starting to see definitely in different states is it's not necessarily going up. Like, there have been some levels of maintenance, but not necessarily worse effects. But there is some data to say that there are actually people reaching out to the services that are out there. And yes, there's some messages that are saying that some of the services are still quite maxed out, which is one of the very reasons why we're continuing to advocate prevention. And if we can be there to support each other in that community spirit, and don't be afraid to have some of these conversations if you're worried, etc., we can start to hopefully reverse some of that trend from happening. Any further comments from our initial chat or being part of this little discussion today?
No, just you don't need to know everything about counselling and services and referrals. That's why there's services there to help you. So if you're worried about someone or you do want to reach out, look for, those community services. They're a good place to start. And if they're not the right service, they'll know where to go. So ask, make a phone call, just start that conversation. You don't need to know everything to start that conversation.
Yeah, oh, absolutely. I will just pick on, I know you're not just working with youth, you've been working with workplaces as well. Any insight there in terms of mental health in the workplace?
I guess for the workplaces, I would really say is that obviously colleague relations and I guess people having breaks in different ways. We're doing so much computer work right now, it's really increasing our stress level, and it's really increasing our, reactivity. So everything has to be done right now. I'm getting emails, I'm getting pop-ups, I'm getting everything, and it's overwhelming for everyone. So just being really mindful of how you're managing your day, how you're breaking it up. Do I feel connected to my workplace and my colleagues still? Am I getting that balance I need that I used to get naturally through just lunch breaks and, you know, going to meetings in different offices and going to networking events that are not on anymore? And how can I get that balance in my work? Because it's hard just to look at a screen all day, and it's not really how our brains are made to work.
For sure. So we are getting tired and we are feeling that level of exhaustion. So thank you so much for your time today. I really appreciate you being part of this campaign, and I look forward to continuing to spread the message and continuing to advocate mental health promotion alongside you, Sacha.
Yeah, you too. Thanks, Ali.
Fantastic. All the best. We'll stay in touch.
Bye.